Welcome to COVID Collateral. On January 23, 2025, a panel of scientists and theologians discussed the COVID-19 response following the screening of the documentary film Covid Collateral, produced and directed by Vanessa Dylan, to a live audience at UBC's Frederic Theater. The panel consisted of 3 UBC scientists from the Canadian Citizens Care Alliance's Scientific and Medical Advisory Committee, along with 2 theologians from Regent College. They discussed the COVID-19 response following the presentation of the documentary to an audience of over 330 people. Panel participants are Dr. Hsiang, UBC Professor Emeritus of Surgery, Dr. Stephen Pelech, UBC Professor of Medicine, Dr. Christopher A. Shaw, UBC Professor of Ophthalmology, and Regent College Professors Bruce Hindmarsh and Jen Zimmerman. Your host was Kid Carson. The UBC event was also the official launch of 2 books from the Canadian Citizens Care Alliance. Down the COVID-19 Rabbit Hole, Independent Scientists and Physicians Unmasked the Pandemic, and COVID-19 Pandemonium, a pandemic of ignorance, fear, and greed, the capture of our institutions. Both books were edited by Dr. Stephen Pelech and Dr. Christopher A. Shaw. Links to purchase these books are in the video description.
As the virus continues to spread, so does fear.
Stay home.
To shelter in place.
Keep your foot on the accelerator, because that's what's going to get us through this.
The public did not know that there were prominent scientists that disagreed with the lockdown policies. They wanted to create an illusion of consensus.
And this was shocking to me. In a free society, to simply decree the lockdowns.
The federal government was working with social media companies, censoring dissenting opinions.
If the government is engaging in unconstitutional acts of censorship, who has the power to stop it?
It's just the most damning discovery.
Suddenly, just boom, you're fired and no explanation.
It was more than just silencing, it was shutting me up.
Even though we had the data, the media just wasn't presenting the data fairly, and neither were the public health experts.
People that we've trusted to be knowledgeable are not. They're simply not.
All the information pointing to a cover-up, it's all public. It's all there in front of you. I think Congress is going to have a hard time really getting to the bottom of what happened.
Do you recall at some point anybody raising concerns to you at the beginning of the outbreak that the virus might have been genetically engineered or originated in a laboratory?
And now, the panel.
So we really want to get to open up the floor where you guys can ask some questions. I'm sure your wheels are spinning of things you want to ask this esteemed panel here. So we're going to whip through a couple of questions that we've got to set the stage here. I thought a great way to kick things off would just be to have each person quickly introduce themselves for 30 seconds and what their background is. You guys would do so much better job. I'll probably, some of your titles and your accomplishments are so long, I will be up here fumbling over my own words for 5 minutes with each of our panel guests. Can we start? Dr. Pelech, could you maybe start with, you're the guy who invited me, so we'll start with you.
Thanks, Kit. I guess many of you do know me. I'm Steve Pelech. I'm a professor in the Department of Medicine at the University of British Columbia. I'm also the Vice President of the Canadian Citizens Care Alliance, and along with Chris Shaw, we're the co-chairs of the Scientific and Medical Advisory Committee. And as some of you participated in the clinical study that I led, looking at SARS-CoV-2 antibody levels, and I thank you very much for participating, and also for coming this evening.
Hi, everybody. I'm Hsiang. I'm a professor emeritus of surgery at UBC. I'm a vascular surgeon. I worked at the Vancouver General Hospital for 34 years. And then I stopped working there in 2021. And since then, I'd become the founding president of the Canadian Society for Science and Ethics in Medicine.
My name is Christopher Shaw. I'm a professor here at UBC in the Department of Ophthalmology and Visual Sciences. I had a little bit of an little lapse there while I was off work for almost 2 years because I wouldn't take the shots. So I can relate to the movie we just saw. And as Steve has mentioned, I'm the co-chair of the Scientific and Medical Advisory Committee for the Canadian COVID Care Alliance, now the Citizens Care Alliance. And I got myself a book to give to my chairman tomorrow because I have my annual review. So we'll see what happens.
Hi, I'm Jan Zimmerman. I teach theology at Regent College. Just want to say thanks to Stephen and York, who have been anchors of sanity, truth, and eventually friendship during a really crazy time that we've seen. So thank you for putting this on and for having us here.
And I teach with Jens at Regent College. I'm a professor at Regent College, an affiliate college with UBC. And I'm a historian and a theologian, but it's as a historian that I first got interested in studying COVID and thinking about, have we been here before? And then thinking, okay, as a historian, I can weigh and assess evidence, and how much can I make sense of this? And began writing about this, and that's how I made contact with Steve and began to write and think more with Steve and others. Yep.
We have some questions here to get things going for us tonight. Let's start with Stephen. Was the COVID-19 pandemic a consequence of a genetically engineered virus?
Well, if you read our book, which is, we went into this in COVID-19 Pandemonium book, the blue book. And we have a whole chapter on this. And really the bottom line is, Jen Zhengxi, the research scientist, the bat lady that was shown in the film, she was actually a graduate student of Ralph Barrick, who was actually doing this work with bat coronaviruses in the US, but then could no longer do gain-of-function research. So it went with her to the Wuhan Institute for about 10 years. They found this virus that was 97% genetically identical to SARS-CoV-2, but has features like SARS-CoV-1, and all the telltale signs that this is actually a genetically engineered virus. So when Dr. Fauci said, well, you know, eminent scientists see that they could see this evolved naturally, that is not what the conclusion, for example, the subcommittee of the US Congress found, and certainly what we don't see in our book and many other scientists. I think most people recognize now that this virus was a consequence of genetic engineering, which is still going on around the world. And the claim has been that, well, you know, we're taking all the safe precautions. Well, that's what they did with SARS-CoV-2. And look what happened.
I also want to say that Steve was like the first important big deal doctor to come on my podcast after I was fired, which was so cool. Because when to have someone, when everyone is calling you crazy and then suddenly you're like, PhD, UBC, everyone's like, whoa, it was very good for me. Was the development of the COVID-19 vaccine an effective response?
We have to recognize that everybody didn't really know what the true threat was of this virus initially. We could learn a little bit from what we know from other coronaviruses, and from that, we shouldn't have been as concerned, but it was seen as a new virus, and a lot of measures were taken to try to protect the public, and you can't fault the regulatory agencies and health professionals in trying to come up with a solution, but it was a rush job. And a lot of the safeguards that are important for any product, whether it's a vaccine or a drug, were basically with a brand new technology that had only been actually tested in a phase 3 clinical trial with people for 2 months. So there's no way that we would have any long-term safety data or even efficacy data after 2 months. And so we go into this again in our book. The first book, the Down the Covert Rabbit Hole, really explains that. And I think the consequence of all this is that, unfortunately, these genetic vaccines, again, a new technology, even developed in part here at the University of British Columbia with the lipid nanoparticles from Peter Cullis's lab. And it still has potential, these lipid nanoparticles, but not for the use of vaccines, in my opinion. And I think what's happened is we can see from the data now that the more you get vaccinated with these vaccines, the more likely you will get COVID. Which I know is remarkable, and certainly not the public messaging you're hearing from Bonnie Henry and the like. but the data is continually accumulating, and we cover quite a bit of this actually in the first book, Down the COVID-19 Rabbit Hole. And since we published the book, there's been even more studies that come out, so this is where we're at. So the vaccines have their side effects, which are actually, in my view, unacceptable for a vaccine, and they are not working the way we had hoped they would. But there are many other vaccines that are underway that are RNA vaccines, and that's why we have to learn from the lessons from COVID-19 and why it's so important to have these kind of forums so people are aware.
I'm going to hop over to Chris, and this question's for you. Describe the impacts that the books discuss concerning the other larger scale implications of the measures taken to control the pandemic.
Okay, I think the movie did a really good job of bringing some of those out, and I think we've all experienced it. Those here in the audience have all seen what the impact has been over the last almost 5 years. The first book really, delves into what happened to the people who got sick and the consequences of some of the vaccine products that were made. And we know, people did get sick. Some people died. Many of them were in care homes. Many of them had comorbid conditions, and that's all very sad. But I would argue, and we do that in the second book, that society is built on trust, and what we have fractured in the last 5 years is probably going to take a long time to repair. We have fractured our sense of trust in government, if we had any before, in the media, in the legal profession, in the medical profession, in the academic world, in jurisprudence, and a whole range of things. And it's going to take a real effort. And I think Jay Bhattacharya said it very clearly. He said it's going to take a long time to fix what's been broken over the last 5 years. And that may be the key thing that we need to work for is, not only to learn from this particular pandemic and the government response, not to let it happen again, because I think that's crucial, and I think Steve is quite right about that, but also to begin to figure out how we fix all those things that were broken.
Can you talk a little bit about the measures that we address the spike protein harms in the vaccinated?
In terms of, sorry?
In terms of the spike protein.
Okay, yeah, no, thank you. We talk about that in one of the books. We deal with that because, of course, there are various protocols out there. I think Peter McCulloch has one that uses various kinds of proteins to extract the spike protein. Other people who are looking at other receptors, such as the N-acetylcholine receptor, have their own protocols, and McCulloch is also aware of that. There are cannabinoid products can be used to combat the spike protein. And there are a whole range of things, and we discuss these in some detail in one of the chapters. I think it's probably the longest chapter, and I'm sorry I'm responsible for that, but along with some others, many others. And I think there are other ways to get rid of it, because if insofar as the spike protein stays bound into your cells, those cells are potentially being destroyed. That's bad enough. And we know we've had a huge number of cases of myocarditis and cardiac events. We know we've had a whole series of things involving autoimmunity. And my fear as a neuroscientist is that really that once we are looking at the emergence of neurological disease, and there's already several clusters of Lou Gehrig's disease, that my concern is we're going to see a lot more of that. And I'm not, I'm sure the audience is aware of Bill Mackis and other who are looking at the, what do you call it, turbo cancers, very aggressive, very rapid cancers. So these are all things that we as a medical community, we're going to have to deal with in the coming years. And I think, the more remedies we can come up with, the more ways we can find to detoxify people from the spike protein, I think that's going to serve us well.
Let's hop back over to York. Also, a guy who came on my podcast a couple of times, which I greatly appreciated. We had some great times. Great to meet you in person, by the way. It's always over Zoom, right? Likewise, crazy times. A question for you. Were complications more likely to occur after COVID-19 infection or after being vaccinated?
That's a great question, and it's an ongoing question. The real answer to that is that it will never be known. And the reason why it will never be known is because all of the initial trials that Steve was talking about, phase 3 drug trials, were all terminated. And those were proper, blinded, randomized controlled trials. Once you have terminated them, no one else is going to do another phase 3 trial. So what we're left with is we're left with kind of like junk science. All right. What I mean by that is that since you want to try and eliminate bias and so get to the truth of the whole thing, what other types of trials or studies can you do? So the majority of the studies primarily are focused on what's known as retrospective databases, which is controlled by government. So what gets into the databases are things that broad classification. If you want to study myocarditis, myocarditis is based on a blood test. It's not based on a clinical finding. So if anyone has an elevated troponin, for instance, they get myocarditis. The problem with that is that in a large database, you're subject to the people who's actually collecting the data, and you're subject to the people who's defining it. Overall, the real difference is that spike protein, whether it's from the virus itself or spike protein from the vaccine, is a little bit different. The way it differs is that the amount of spike protein from the vaccine is phenomenally greater than if you get COVID infection. Number two is that the vaccine is carried in this lipid nanoparticle, which once injected goes to every cell of your body. As opposed to a COVID infection, which has to naturally come through your nose and down into your lungs, and from there, if your immunity is not good enough, it'll then spread to your body, to the rest of your body. And so I think on balance, when people talk about complications, is it more from the COVID infection or more from the vaccine? I would say it's probably more from the vaccine.
In your opinion, why weren't more doctors speaking out?
That's a great question. I mean,
I got it right off this piece of paper, so it's great.
I've often wondered that, and there are a lot of different ways of looking at it, but I would say the simplistic way of looking at it was that doctors are really just trying to protect themselves, protect their incomes, protect their status. But 5 years later, with all this information available, why haven't more doctors come out? Why haven't more doctors spoken about this? And one of our members of our group, the Canadian Society for Science and Ethics in Medicine, posted a really interesting article and used the term prone doctors. Prone meaning face down. And it's basically to describe the behavior of doctors. The vast majority are prone. They are lying face down. They have not stood up. I don't know why. Simplistically is that you've gone through an entire pandemic. You've been bombarded by media, your hospital, the college, and warned you have to treat patients in a certain way or else. Well, you've gone through all that and you've lived through it, but we're going through it again. The hospitals now require mandatory masking. For what purpose? You would have thought that if you were prone for so long, you would finally get off the floor.
We'll hop over to Jen's. This is an interesting question because I kind of feel, maybe you've noticed it also, there seems to be a little bit of a spiritual awakening happening over the last couple of years. So this question for you is, most Christian church leaders, as well as leaders of other faiths, they were very quick to comply with the government measures and mandated them to their followers in the name of neighborly love. Why do you think Christians were so eager to work with the government, even though measures like isolation were so damaging to especially the elderly during that time?
Yeah, that's a great question. So we go from junk science to junk theology. It's very difficult to answer these questions as properly as I want to. And I can only speak as a Christian theologian out of a Christian faith. I don't know about other, well, I know some about other religions, but it's simply the loss of fundamental aspects of the Christian faith within the churches. And I mean, the same as what York has been saying is true for pastors that are still face down, that are still not speaking out either after all this time. So let me just say a few. The ones I would like to talk about, maybe we can do this in further questions as well, are the incarnation, is the church-state relation, a proper understanding of how the church relates to the government, and the third is the nature of love, and I can't cover all of that, that'd be like a book. But the incarnation, I mean, Jeffrey Tucker talked about the foundations of Western civilizations and humane civilization to recover that. The incarnation is historically the foundation for human dignity and personhood, right? So we've lost that, and Christian theologians have lost that. So when you isolate people, you take away their dignity. When they're not allowed to commune with loved ones, you take away their dignity. And no cause of a pandemic and going to zero COVID and so on should trump personal dignity. And if Christian leaders didn't see that, that is tragic. And they should have protested against it. They should have, thrown themselves against the doors of the old folks' homes and says, we want in, or at least let somebody in to commune with these people. And to let people die alone is not just inhumane, it's deeply unchristian. See, for what follows from the incarnation, which I can't really explain in detail, is that we're spirit and body beings. We're not just physical, we're spiritual, and they're both together. And human beings flourish when both of these are served together. And to throw an elderly person an iPad and say, here, commune with people, without the body, without the bodily presence of another, and these kind of things, is deeply Christianly wrong in terms of our biblical faith. The same with what happened in the churches. So we believe as Christians that God's presence comes to us through material means. We call them sacraments. And really, in some ways, we are a sacrament to each other. We communicate God's presence to one another in real embodied circumstances, right? That's why the Christians call the church the body of Christ, which is Christ himself calls the church my body. So for church leaders to put a vaccine between worship, being able to attend worship, or you say, well, the Eucharist, one of our most important sacraments where God's presence is believed to feed us, to say, unless you're vaccinated, you can't participate in it. That's a man-made injunction against what God has ordained. So how can Christian leaders, why didn't they protest? Why didn't they put their bodies between these kind of insane kind of things? Really quickly, church-state relations. From the early beginnings of the church, it was a Christian confession that Christ is Lord and Caesar is not. So the only way that we believe in the constitutional or the God-ordained purpose of government is if it serves humanity, if it serves human flourishing. If it doesn't, we don't have an obligation to obey the government. So why do Christian leaders just, collapse and just eagerly participated and fell over themselves to serve the government? And finally, the nature of love. You remember, one of you, I don't know if Kit, you said it, one of you said it. The mantra, do you remember? Do this in the name of neighborly love. Get the shot in the name of neighborly love. Mask up in the name of love your neighbor. How can you not love your neighbor? It's a noble Christian sentiment, but in our Bible, Christ says, I'm love, truth, and life. So you can't separate love from truth or life as a whole. But that's precisely what Christians did. Like Christian leaders, well, let's love, meaning we're going to follow these things. Well, are they true? Are they beneficial? Do they support human dignity? Those are questions they should have asked, but they didn't. So you're just browbeaten into love your neighbor, as every good Christian should. Well, what about if that's not true? What about if that doesn't work? You weren't allowed to ask those questions. Then you wouldn't love your neighbor. It's crazy. But that's exactly what happened. Finally, last word. Scriptures say love casts out fear. How much of this stuff was motivated by fear? I'll just say the last word here. I taught a course on early Christianity. You know what? For Athanasius is an early Christian theologian. You know what he says? He writes this whole thing on the incarnation. It says in the end, you know what, guys? If you don't believe what I say here theologically, you know how you can know that Christians, that this is true? Watch Christians. They're not afraid of dying. They tend to sick, even though they may get sick and die. They don't care because they're not afraid. Love casts out fear. Again, fundamental Christian truth, completely neglected. And I'll forgo my second question because I've talked too long.
As a historian, Bruce, what got you keen on learning and writing about COVID-19?
Let me say something about that in a minute, but just I want to riff on a little bit what Jens just said. I don't know if you remember, but yoga studios were open, liquor stores were open, but churches were shut down, right? And you go, why is the purpose of the meeting, what does that have to do with shutting it down? The purpose for which people are meeting. So an Alcoholics Anonymous group could meet in the basement of a church, but if they opened a Bible and prayed, it was illegal. So it's just, there are all sorts of these inconsistencies that were going on, right? I just want to encourage you, here I am as a non-scientist and Jens as a humanities guy, is we were told, let's follow the experts. We need to submit, we need to listen to the experts. We're told that over and over again. And I just had this feeling that starting in 2021, I just thought, but what if the experts disagree? And are we being told to obey the experts? But this is really sounds a little bit more like submit to authority. And we'll tell you who the experts are. And this is where I began to get interested in this and think, I need to do a little bit more work. And I'm locked down anyway, so I've got time. And it was, I started to listen to the daily drumbeat of the case reports, you know, in the news. And I was thinking, something doesn't smell right about this. And about, you know, and you start to ask questions about the PCR test and questions about how they're testing and what kind of controls they have. So I called up a reporter at the Vancouver Sun, and who had written the article. And I said, can you tell me more about this? Because it seems like you're just reporting the government numbers. And he said, oh, Bruce, he said, we used to have like a whole floor of investigative reporters that would be on this, but we don't have the resources right now. And that is all we're doing. And just admitted it. And that's when I thought, okay, well, I want to buckle down. As a historian, I'm aware in the past, large numbers of people have been wronged together. I'm aware of things like moral panics. We talk about that in 18th century Britain. Talk about moral panics. I'm aware that people do awful things when they're afraid. So I thought, I need to begin to investigate this, and I began to write about it. And I thought, there aren't 100 issues, but there are about a dozen that have to be kind of sorted out. What is the narrative? And I realized, and this is even in the BC CDC instructions to health workers, to what to communicate to people, that you need to be afraid because the virus is lethal. The virus spreads asymptomatically, silently, and all unawares. And the virus mutates. So you need to be afraid. And I just began to say, okay, well, what do we know? So infection fatality rates and morbidity and excess deaths, and this kind of information is available. And you begin to go through and you realize, well, there are serious questions here. This narrative, something doesn't quite smell right. And then you begin to ask the question, okay, how have we responded? What were the non-pharmaceutical responses like lockdowns and masks? And you ask questions about that. And what about the pharmaceutical responses like we saw with ivermectin and then with vaccines? And what do we know about those things? And do you realize that there are some much deeper pathologies that are going on in terms of, and so some of the kind of pathologies that I thought are socially pathological was, we've seen a lot of them in the film tonight, but I thought the censorship of science, that's just not right. And to see the way with the Trusted News Initiative, and we saw some of that with Twitter, to see, and this wasn't mentioned as much in the film, but covert government communication strategies. So in Britain, this was awful with using sort of nudge behaviorism and being embedded, and some of the documents have come out about the intentional desire to create fear in the population to gain conformity. And in Canada, there's a National Post article that talked about the use of psyops and military strategies on the population to get them to conform. Anyways, I won't go through it, but I just realized there's a number of these pathologies that are as serious, sort of what's happening to us as a society, as there are in terms of the virus itself. So, but I just want to, one other thing is, I want to pay tribute to, to everybody, all the scientists here. But Steve has been absolutely remarkable through all of this. I just began writing about this for myself, and Steve encouraged me to publish this, and I got to know Steve. And he's been just remarkable as an independent, genuinely independent, and maintained his stature, his civility, and his independence. If you buy this book tonight, I think there's 1,070 references in there. And it's just been remarkable to have his encouragement. But so even as non-scientists, I think we're invited to take responsibility to weigh and assess when the experts disagree.
Awesome.
What we'll do now is we have about 30 minutes. If there's any questions, pop up your hand. We have a couple of microphones that are roaming the floor, I believe. Do we have the mics on the floor going on? Okay.
Here you go. Should be on.
I'm just wondering if you're going to follow this up with a vaccine collateral.
Is it working? I don't know. She's wondering if you're going to follow this up with a vaccine collateral.
Yeah, the story just, it's an ongoing saga, obviously. And there's much more that we could have added to the books. I wish we had more about the effect on the various religions. And that's something which is a deficiency, really, in the COVID Pandemonium book. But there is actually another book that's is being done by another author that's out of, I think it's Manitoba. And that book is being actually published in Australia. But it'll be available here. And it delves more into what happened in the churches and also in the families and homes. What we try to do at the Canadian Citizens Care Alliance is we have a series of essays that we're producing on a regular basis that is posted on our website. We have several that are just about to be published, but we will ongoing continue to look at scientific, look to science to critically analyze the information that's being presented and what's in the scientific literature, and try to get that in a form that it's more intelligible for the general public. So in a sense, we do have some plans for other books. One of the plans is maybe a book on the RNA technology itself, its promise and its perils. And another one we think might be worth doing is related to biomedical ethics in a brave new world, which is what we're in now. So we are continuing to trying to produce books and materials.
Can I butt ahead?
Yeah.
A lot of people are reacting to Trump this week talking about rushing out mRNA vaccines for cancers.
Right.
Is there any sort of gut reaction that you get from hearing that?
Yeah, this is, I've seen this before. You know, when the human genome was sequenced over 25 years ago, we heard, oh, now we're going to cure cancer.
And everything else, yeah.
Yeah, and then there was another one was, oh, monoclonal antibodies. We're going to be able to now treat everything. And, from the time to the development of the first monoclonal antibody drugs that were approved on the market, from when it was discovered how to do this technology was 20 years. Okay, so none of this happens very fast. It's usually, and I think it was Larry Ellis, that proposed this. I mean, he's not even a biologist. He has no concept of the complexity and how difficult it is to actually have safe products come to market that are going to be very effective. So, yeah, I wouldn't give it any credence.
Yeah, okay, what could possibly go wrong?
AI.
Yeah, well, this is how it goes. This is what's happened during COVID. A lot of money went into COVID research, but only in certain directions. And unfortunately, with the lockdowns, many university labs for a year to 2 years were shut down. So a lot of the research that we'd be doing in other areas where more people are actually dying, cancer, heart disease, neurodegenerative diseases, their research programs were actually really hampered dramatically. And then when we look at the funding that the Canadian government, for example, is going to spend on biomedical research, the Canadian Institutes for Health Research, we can look at the funding from 2022 to what's projected to be now in the next year, and we're looking at about an 18% drop actually in the funding. But bear in mind that we've also had inflation during that time. So for scientists trying to do research, about 1 out of 4 grants that would have been funded now will not be funded. And as research scientists, when we're submitting our grant applications, only about 1 in 7 grant applications actually get funded. So this is actually going to hamper the biomedical research effort in our country in other directions that will actually maybe make us more innovative. So yeah, there's a lot of repercussions.
Okay, we got our next question here.
Yes, I'm very curious about why our public health goes on offering the COVID vaccine to children. My patients who are public health nurses tell me that they are running clinics where alongside the flu vaccine, they are instructed to push the COVID vaccine, and they're doing it rather half-heartedly. But from children from the age of 6 months up, the fact that this persists reminds me of how the inventor of frontal lobotomy persisted in crusading across the continent even after it was
seriously affected. And I'd love Dr. Shaw's impression of what public health is up to. I'd love Professor Hindmarsh's. Have you been listening to the radio commercials? Yeah, about usual things. We're in respiratory disease period, of course, and wash your hands. Yeah, they save that for the end. But go get up to date on your COVID vaccines and your flu vaccines, or both if you can. And that's the only way. Yeah, it's like that same narrative. The only way out is when you've got vaccines in everybody's arm. That was the mantra almost from the beginning, even before the shots rolled out. And as we've seen in the movie, and as Steve can tell you, very, very clearly, this does not affect children by and large, except children with extreme comorbid conditions. It just doesn't. So this is Bonnie Henry playing fast and loose with the facts and the data, and basically trying to create more of this. You're familiar with the sunk cost fallacy. Why give it up when you've already invested so much time and effort and money into it? So they're not going to give it up. And so they're going to keep pushing this as long as they're in power, I fear.
Okay.
I think there's also an element with public health that is the ethics are utilitarian, and it's not about the individual, right? It's not about, it's not Hippocratic, do no harm, and informed consent, and the individual right in front of me. It's always statistical, greatest good for the greatest number. So and one of the first things that they sort of discovered is it's logarithmic, right? The risk from infants to the elderly, and that there's a 1,000-fold difference in risk in terms of death from COVID. So why this is happening, to a hammer, everything's a nail, to a public health officer, everything's a vaccine, right? Yeah.
Well, just to add a philosophical dimension, is I think it's a combination. I'm more cynical. I think it's a combination of techno-obsession and pharma profit. I think the two totally go together, and that's part of the problem.
So, can I?
And do keep in mind also that a lot of this has a religious flavor, and not in a good way. So a lot of the things, you hear the statements, we trust the science, we believe the science is settled. Those are not statements of science. Those are statements of cult religion. And that's what you're hearing again. You're hearing politicians may not, they honestly don't know. We should still put the books on everybody's desk in Victoria. But the reality is, their event horizon is only to the next election. They don't think about this stuff. They don't have training about this stuff. And one of the things we try and do in the book, and it was in the first book in particular, is we try and educate people. What exactly is science? What does it do? How does it work? Because a lot of people clearly don't know. And sadly, some of them are in public health. And that's a major tragedy when we talk about experts being, and doctors being face down. Well, you're seeing a lot of that, unfortunately, and they do not want to get out of that face-down position, because then if they were honorable people, they'd have to come to terms with the fact, what did we just do for the last 5 years?
So, my question is to the whole panel. My question is for the whole panel up here. Biden has given Fauci a preemptive pardon. And we understand the kind of collaboration that our public health officials did with their counterparts in the US. My question is, how much will that filter over the border, and should we be concerned about some form of preemptive crime committed against us as a population from our public health experts?
So I guess the question is, are you referring to now that we've had a change in administration in the United States? Because actually, this is transformative, what's going on down there. Hopefully, Robert Kennedy Jr. will become the minister in charge of health and food, and Jay Bhattacharya, who you saw in the film, will take on the role as the leader of the NIH, and he would be someone like Fauci's boss, for example. So it's hard to predict how things are going, but it's going to affect us in Canada, no doubt. And I think in a positive way. So we'll see what happens, but there's going to be a lot of resistance, needless to say, from the pharmaceutical industry and those that are vested in the previous narrative. We will probably have a change of government in Canada as well. But it'll still be a challenge for us to make sure that the members of parliament, or here the MLAs, are educated into what actually happened, and that we're going to work very hard on that front.
Oh, great. Hi, I'm just here. I'm curious about vaccine shedding. The comments seem to go all over the place, and I know early on, deep within the literature, one of the big pharma companies did acknowledge that there might be some shedding. So I'm curious about your opinion on that, and should all of us here just assume we've been shed upon and do the and take the precautions, what McCullough talks about, and do that stuff preemptively?
So I think it's pretty clear that shedding phenomena exists, that there are physiological changes that occur in non-vaccinated people when they're near vaccinated people, especially after they've just been vaccinated. The nature of what that is complex. It may well be a combination of several things. One, shedding the actual vaccine, shedding the spike protein that's produced from the vaccine, shedding what we call exosomes. So these are fragments of cells that the immune system most likely has attacked because it has the spike protein on it, and therefore someone else may be exposed to either a little bit of the vaccine, so they'll produce the spike protein themselves, or they're being receptive to getting a little of the spike protein. However, I don't think it's a phenomena that we have to be too concerned about. Maybe in a blood transfusion, perhaps, if someone just got vaccinated, there's one scenario I could think of that might be a problem. But for most of us, with the shedding phenomena, it's very dilute. And it's going to be not inside, your circulation. It's going to be more or less down your gut and in your nasal pharynx area, which you're continually clearing. So, and that's where your strongest immune response is, actually, to the virus in the first place. So I don't think it's something that you need to be really overly concerned about, but it is a phenomenon, and I think it does reflect many different things happening at the same time.
I'll just add to that. I think Steve is right. Yeah, I mean, it is a real phenomenon, but I think we've all had COVID, and so we all have natural immunity now. Okay, so I think the impact, and as was mentioned, here in the panel and on the movie, the amount of spike protein you're getting from an injection is vastly more than you're going to get from the actual disease. So if people shed on you, you're probably going to deal with it pretty well, would be my guess.
And I'll further add, when you're vaccinated with a Moderna vaccine, you're getting the equivalent of about 100 micrograms of RNA. So this is what you say, well, what does that mean, 100 micrograms of RNA, compared to 30 micrograms, for example, with the Pfizer vaccine? Well, 100 micrograms is the number, from that you can calculate the number of genes that are being injected into you with the inoculation. And it's in the tens of trillions of copies of the gene. Within each lipid nanoparticle, you have about 5 to 10 copies of the gene. If you were infected with a virus, you'd get like 1 copy of the gene. When you have typical vaccines that are, attenuated viruses, that they're weak, so they stimulate immune response, but they don't really make you sick, you're getting maybe 50 to a few thousand copies of the virus. But you're getting tens of trillions of copies in lipid nanoparticles, which are protecting that RNA. And once it gets inside the cell, this RNA has been engineered to be more stable, and you can produce many, many copies, probably hundreds of copies of the spike protein from each mRNA. So when Chris is saying about, the amount that you're getting from shedding, and you're comparing to actually injecting it right into your deltoid muscle, and in 2 days, 76% of it is already spread throughout the rest of your body, that's a totally different comparison. So you don't expect to see the kind of injury and side effects that you would from an actual vaccination.
And following up on, we talked earlier about how funding, Steve mentioned funding. CIHR is very unlikely to fund the research that needs to be done to examine that. But maybe Jay Bhattacharya, running the NIH, maybe with a new director of the Institute for Allergy and Infectious Disease, maybe he'll actually take a look at it and see if he can do something about it. And that's what I'm hoping.
I just wanted to mention about the lying prone idea that you brought up. I don't think it's lying prone so much as keeping your head down. Under the
ostrich in the sand? Yeah, that one too.
Well, no, it's you don't want to get it cut off. Under the current situation with the Bill 36 in British Columbia, if you do poke your head up a little bit, it'd be a $250,000 fine and up to 6 months in jail. The colleges have been basically disbanded and replaced with government appointees. So when you talked about the brave new world, it's here now. And I really admire any of the healthcare professionals who have stood up and said something. It's extremely brave. Some of us are just going to stay prone in the meantime because I haven't got $250,000 in my back pocket. But that's the problem, and I think the reason that a lot of them will not speak. They know it's wrong, but it's so oppressive that they'd be foolish.
Yes, no, you're absolutely right. There's a huge carrot for many of them to promote the vaccine. They actually made a fair amount of money actually having their patients get vaccinated. But there's a terrible stick. And as you pointed out with Bill 36, one of the things is that even if, and York and I and others have been involved as expert witnesses in those court cases, and the process, how prolonged it is and how expensive it is the punishment. Even if the doctor at the end of the day, or the nurse or other health professional, manages to have the disciplinary college dismiss basically the charges, they've spent so much money and so much time, and Bill 36 makes it even worse. And so we don't have time to go into that in detail, but we have information about it on the Canadian Citizens Care Alliance.
I just want to make one comment to that. Prone doctors is a real thing. The doctors could have fixed it. These forced vaccine mandates did not happen in every province in Canada. It didn't happen in Quebec because 10,000 nurses said no. That's what happened. I'll give you an analogy. If all the trash collectors went on strike and asked for higher wages, within 2 weeks they would get higher wages. If all the a very small group of doctors, let's say all the emergency room doctors went on strike because of Bill 36, that would crash the system. But they don't.
And they also, you all know who Charles Hoff is. Okay. They're making an example of him, and they've made that very deliberate and very clear that they're going to make him the main target of this, to show what happens for doctors who get out of line and do what they're actually obliged to do under the Hippocratic Oath, and that's all what Charles Hoff did. So this is precisely what Bill 36 is going to do, this in spades, and that's what its intent is.
I want to stand here before you and first of all say thank you for everything that you guys are doing. I am standing here as a vaccine injured person. My story got shared on Christmas Day and went viral on X with 1.2 million views in less than 24 hours. I've been seeking treatment to figure out why my period stopped and why I'm unable to have children. All of my doctors have pushed me away several times, naturopaths, all the blood work, and nobody could find answers. I finally was able to get the correct testing through a Rife machine and able to find 22 spike proteins in my blood. And most of them attacking my fertility. Since then, I've gone through a detox and I have one spike protein left. And I'm really grateful. It's quite interesting. I'm looking at your name of your company, and actually my name's Callie, which is actually in your company's name. And I got invited to be here yesterday, so I'm grateful to be here. And I look forward to connecting with each of you because I think that what I've taken may help a lot of people. And I've already emailed Dr. Shaw. Vanessa actually sent me his email yesterday, so I look forward to connecting with each and every one of you. And if I can be a voice to help other people, I will. And if that's the last thing I do, I'm here to stand with you guys.
Oh, yeah, sure. No, go for it.
Yeah, I won't stand up then. It'll take too long if I do, because I like to talk. I'm a vaccine survivor. 14 years, took the 2010 vaccine, became a quadriplegic, 8 months in the hospital. There's so much to my story. And Vaccine Injury Compensation Canada. So you get lots of the VCCs, like Ted Kuntz, who is a wonderful man. And you can look at my story at ramgbs.wordpress.com. Bob Martin. Search me out. There's lots of information. You want to talk to me after, I'm happy to do it now. To you guys. Spreading the disease after they give them the shot. They got to stay home for 2 weeks with all their family. Anybody that wants to travel stays home for 2 4 How long are they going to keep taking shots? 14 years I've been fighting them. Had things go to the federal government, sit on the table, die, and not even be talked to. The changes have to come. Polyev or whoever goes into position, he has to sit down with us. I'm an expert in what I'm talking about. I got 14 years of back to 1835 talking about vaccines and how much bullshit went on then and how many people died and how it didn't work. So anybody gets vaccines, go home and stay there like we were told. Go home and stay there. Thanks very much.
Hi, thank you very much for such a wonderful evening. I'm Joanne Mulhall, and I am part of the Canadian COVID Care Alliance, or Citizens Care Alliance, but also of the telehealth team. And also, I just thought it was timely to speak about a new initiative, which is the CC19, or Can Connect 19 group. You can look up that online, and it is a new group that we just did a soft launch tonight. Actually, the webinar was right before I came here. And it is an online forum to connect vaccine-injured individuals. It is to take the place of all the Facebook groups and Telegram groups and all the groups that had been started by caring individuals who really just got burnt out and lost their momentum to really do that. And so I have to give Dave Ross amazing credit for that. He's down east and he's worked tirelessly on getting this established. And we invite anyone and certainly all vaccine-injured individuals to look us up. It's Can Connect 19. It's a not-for-profit. It is a community group. We will have resource information. We will have certified practitioners, I being one of them, and my colleague Wendy Roscoe in Ontario, who is also a functional nutritionist. We both have over 50 years between the two of us, as well as nurse practitioners and mental health counselors, to be able to work with everyone. You have a voice there. You have a place to meet other individuals, to talk about your stories, and also to hopefully find connection, but also help and direction. And a lot of it is really just about also getting to the fundamentals of good health, which starts with very basic things. And we're looking forward to just really connecting with anyone and everyone who wants to be able to do that. I did have one question that I would quickly ask. With regards to the Wuhan thing mentioned in the lab, I mean, there's also some implication that the Canadian lab was involved in that. The the Winnipeg lab, the level 4 lab. Can you speak to any of that at all? Because there was a lot of shenanigans around that a few years ago as well.
Yeah. I mean, this is the case of where basically, I guess a Chinese doctor and her husband, actually from China, she was a Canadian citizen, they were escorted out from the level 4 facility that's in Winnipeg by the RCMP for about 2.5 years. We didn't know exactly what happened. That story is actually in one of the chapters in the book, the COVID-19 Pandemonium book. We cover that in the chapter on the origin of the virus. But it's complicated, so I think it's better to read that section of the book. Yeah. Yeah. There was a question down here.
Yes.
Oh, sorry.
Yeah, we'll get the next text.
Yeah. Hi there. Thank you for being here. It's been a fabulous night. It feels so good to be with like-minded souls. What do you know about the prevalence or the proposed distribution of these self-amplifying RNA vaccines?
Okay, I guess I get to talk about. Yes, these self-amplifying vaccines, basically the way they work, that's different from the lipid nanoparticle RNA vaccines now, is instead of having just the spike protein, they actually have additional genes from the virus that allow it to remake like a RNA copy from the RNA that's there. The RNA that's often there is going to be like we'll call it positive sense strand, and you make an opposite sense strand, a negative sense strand, as a template to then generate more positive strands, which with the positive strands you make the proteins. So the level of production, I think the technology is going to require a lot more work to be able to know how to control that. But nevertheless, it doesn't matter. Because if you're putting a foreign protein on the surface of your own cells, whether it's with the self-amplifying RNA vaccines or just what we've seen with COVID-19, it's the same problem.
But does it spread more easily in lots of populations?
No, it's going to be the same. The question is, what is the level of expression of this and how long? I think the idea here is that it's going to be a persistent. You're going to be able to produce that protein on the surface of your cells longer. Now, I would say if that's the situation, then you're opening yourself to more inflammatory attacks of those cells. And there's, of course, very little data about this at this time. My own feeling is that the whole technology of using RNA vaccines is doomed. But there may be applications for RNA for where you're not trying to use it as a vaccine, but as a therapeutic to treat cancer or some of these other diseases. So there is opportunity, but a lot of work has to be done.
Hi, Stephen. I'm just halfway through your book, and I'm really enjoying it, especially the part on the immune system. I didn't get vaccinated because I've been studying the immune system for 10 years, and I had one simple question. What's this going to do to my immune system? And you wouldn't believe the reaction I got from people. Now, your book, I guess, probably is about 6 months old on the data of what the vaccine does to your immune system, the P53, the toll-like receptors, all the, the different mechanisms. Has there been anything else learned in the last 6 months to a year on what the vaccine does to the immune system? Because it's pretty damaging. It hits both the innate and the adaptive. And
well, I'll answer that. There was a study from the Cleveland Clinic, hardly an anti-vaccine organization. They looked at, 500,000 people? 51,000 people, and they found that there was a relationship between how many times you got the COVID RNA vaccine, I think it was Pfizer shot, and how often you got sick with COVID. And the people who were at the lowest part of the curve were those who hadn't had the shot at all. Then you took one, then you took two, then you took three, then you took, et cetera. And so, you have to wonder what people were thinking when they, and someone was talking to me tonight saying she has a friend who took 7. Like, what? And that's not unusual. What are they thinking? What are they thinking if they have to go back over and over and over again? But what it's showing us, the Cleveland Clinic data, insofar as they're correct, and I suspect they are, what they're showing us is that you're diminishing your immune response with each shot you get. And that, ultimately that has to have a consequence. And I think it is. And every time, again, as Steve has mentioned, you're giving yourself trillions of spike proteins with each shot, and they're going everywhere. What's going to happen? What's going to happen to the various organ systems in your body when you do that? I don't think the answer is good. So, short answer, yeah.
Yeah, and basically what's happening is your immune system is being completely encountering a situation that never occurs in nature. I mean, the levels of spike protein that you get from the vaccine, you'd have to be almost dead with this virus spreading through your body to get that kind of level of expression. So your immune system, it's confused and it's distracted because as we have in the chapter in the first book, we describe how the immune system works, and you have your innate immune system, and it's being occupied dealing with what they think is the foreign infection of your body, whereas that immune system is also very important in protecting you against cancer. So what ends up happening is you're probably accelerating the rates that cancer cells can grow without the immune system being there to keep it in check because it's distracted dealing with this. We know from Ontario Health billing numbers that the number of cancer cases in Ontario has actually increased in 2021 and 2022. We don't have the 2023 data yet, but it's much higher than what the trends were in the previous years, even in 2020, when there was no vaccine, but there was the virus. So clearly, it's correlative, but it does look as though there might be a linkage, with timing at least, with the vaccines.
I should mention that was done in women in Ontario, and a series of various kinds of cancers that were identified by one of our colleagues in CCCA.
Do we understand more about what the mechanisms are, though? P53 or what else?
I've got a question. Are you is this
I think with the mechanisms for the P53, it's a bit complicated, I think, for this audience. So I'm happy to try to see if I can deal with that with you more, but we do know that there is a relationship between the vaccine contamination and potentially the spike protein. The P53 is one of those proteins you have in your body that protects you against cancer. And normally it's defective in many people who get cancer and makes it easier. It's kind of like a brake on cell growth. So the fact that you would interfere with this could facilitate actually cancer. We got a lot of questions.
Hi, I have a question. So I'm here. Hi.
Right in the middle.
Yeah, right here.
Okay. Oh, yeah, I see now.
So thank you very much. It was great to see
We
the
have
video.
these blazing lights, so we can actually not see anybody.
Well, that's okay. Here comes the question. You don't even have to see me. I can be just a disembodied spirit speaking to you.
Well, not yet.
I'm getting there. So, before COVID, I was a proud Canadian, and I believed that my rights and freedoms were protected by the Charter of Rights and Freedoms, etc. So what I saw, I was never afraid of the virus, but I became very frightened of the government and what they could do to me and to people collectively. So, yeah. And I'm glad it's over, but that's exactly what I was going to say, but it's not over. So the mask mandates are coming back. I was very pleased to hear about the 10,000 nurses that said no in Quebec. So we've been talking, retrospectively about what happened and all of the science behind it, which I very much enjoyed. But I'd like to look forward now. I want to know, as an individual and corporately as Canadians, how can we take back the power that we had originally as a democracy? And how can we protect ourselves from this ever happening again, that this horrible mess ever happens again? And I'm just asking you guys, I know that you talked about prone doctors, and I understand that people can lose their jobs, etc., but over time, any social change always had a huge price. How do we motivate people to stand up, regardless of the cost, to protect our rights collectively and not allow the government to have that much power ever again?
That's a really very profound question, and one that I don't think we have a clear answer to, but I think one answer is education. Everyone's sitting on the stage with the various books and the work they're doing at Regent College, educating people and helping them understanding what science actually is, understanding what it can do, understanding what's happened during the pandemic, understanding the violations of human rights. I mean, Section 7 of our Charter of Rights and Freedoms might as well have not have been there. People just ignored it, or the government just ignored it. So the only way out of that, and Matthias Desmet says this when he talks to people. Sorry about my phone doing. Matthias Desmet says that keep talking to people, keep engaging people, keep spreading questions and conversations with them. Don't ignore them just because, yes, they treated you like garbage for, a lot of people treated you like garbage for 5 years. But that doesn't mean you ignore them. You go back and engage and engage and engage, and use the knowledge you can get from these books and a whole host of books that are out there to actually begin to develop that kind of knowledge so you can fight back effectively. Eventually, it will come down to the politicians who will realize that if enough people are educated, more people are going to say no, and they're just going to say, no, I'm not doing it. And we're all not doing it. And that's the way out.
I think Chris is right, and it's a really good response, I think, in terms of education. I was so disillusioned to find, I mean, have you read the Canadian Charter and all the rights and freedoms that are there in terms of freedom of assembly, freedom of worship, the right to earn a living, freedom of assembly, all these, freedom of speech, all these things that are there, but how it all just collapsed like a house of cards. It's like declaring eminent domain. We're just going to declare eminent domain. And I think, like Jens is saying, and like Scott Atlas was saying in the film, these are blooms that need to be refreshed. We need to reinvigorate the idea of constitution. The whole point of constitutional rights is constitutional law is different than positive law. These are precisely there for minorities. It's to protect those who, when the majority thinks otherwise, these are still the rights for everyone. And so I think everything we can do in terms of education, but Bruce Party and others need to help us in terms of also educating us in terms of law and in terms of rights and what's at stake. Preston Manning wrote a couple of real good pieces during COVID about even balance of harms, so that you can't just declare eminent domain over one issue. You have to think balance of harms and so on.
Joseph, I'm sorry, I'm going to jump in there, Kate, but Joseph has had his hands up for a long time. I wonder if he could get a question in.
Thank you. Next week is the third anniversary of the Freedom Convoy. Protesters started showing up on the 27th and 28th and 29th, and some of you people were there probably. So I have a question here. I remember meeting one person a long time ago who said, you shouldn't call it a pandemic, you should call it a plandemic. And I thought, oh, that's off the chart. But the last 3 years has shown me differently. One thing I didn't see in the movie was there was no mention of Event 201. I was wondering if you could have, because when I saw Event 201 preceding the pandemic, the penny dropped for me. Because the top spook in the United States, Avril Haines, sitting, chatting to the head of the Wuhan lab and the head of the Chinese CDC. And like, what's going on here? What did you think of Event 201?
Okay. You want to go first here?
Well, I wasn't there.
He was lying face down on the ground, yeah.
My conspiracy theory about the whole thing was this was a get Trump thing for 2020. I think all of this is the plandemic. If one thing doesn't work, we'll try this, we'll get Black Lives Matter, we'll burn down the cities. So that's my conspiracy theory. That's the plan. It's not just one.
So, Joseph, I spent some time in the military, as you know, and what you do before you go on an exercise or before you go on an operation is you practice. So does it mean that's what they were doing? No, but the lineup at that event was very odd, and considering who funded it, it was Bill Gates and the Gates Foundation. It was the Bloomberg School of Public Health out of Johns Hopkins. It was a lot of players who seem to relish this kind of stuff, and it does seem very odd. They did it in October, and then the virus was announced a couple months later. I don't know. It doesn't mean that's the way it happened, but for me it doesn't pass the sniff test as being totally innocent.
I think one of the issues is, again, my question is, I don't know about the Trump thing. I think it's bigger. And my question is whether these people actually believe that new technologies and the way of following the security paradigm, which you can trace, right, from terrorism, we've got to fight terrorism. How do we fight terrorism? How do we fight bioterror? And then how do we, crowd control? Because one of the things that struck me is the military nature of the whole of the whole pandemic, right? I mean, containment, lockdowns, those are not medical terms, those are military terms. And you could see the paradigm by China put out there in Korea, North Korea also, people spraying military style the roads and all of that. The effort, it's completely insane, but there is a crowd control dimension here, and I think we need to be aware of that. So there's an obsession with the idea that technology and crowd control will actually bring us somehow a better future. And that's really problematic, and I think people need to be aware of that.
We have so many questions, and unfortunately, we have to vacate this place pretty soon. So food is half price. And we'll have a little bit, still some books, but we do have to call it an end for the evening. Thank you.